in the symphony of men's wellness, your prostate plays a surprisingly pivotal yet often overlooked role. This small gland, nestled deep within, is a powerhouse for crucial biological functions. Neglecting its health can disrupt the entire orchestra of your well-being, leading to a cacophony of discomfort. Understanding its importance is the first movement in a lifelong score of vitality. Many men, like a ship adrift without a compass, overlook the subtle signals their body sends. Early symptoms of prostate issues can be as inconspicuous as a faint echo in a vast canyon, easily dismissed until they crescendo into a formidable roar. Urinary frequency, a weak stream, or nighttime awakenings are not mere annoyances. They are whispers from your body, urging you to listen before they become shouts. Ignoring these crucial signals is like trying to navigate a dense fog without headlights. It makes the path ahead far more perilous. Regular screenings act as your navigational beacon, illuminating potential issues before they become deeply entrenched. They offer a clear view, guiding you safely through the labyrinth of men's health, ensuring you stay on course for optimal wellness. Proactive care is truly your best defense. Consider Rodney Bernard, an African-American man in his early 40s, a diligent architect of his own future. Rodney understood that building a strong foundation for his health was just as important as designing groundbreaking structures. He embarked on his prostate health journey with an open mind, recognizing that knowledge and timely checkups were the blueprints for a robust life. Rodney's proactive approach sets an excellent example. So, what exactly can you anticipate during these vital screenings? It is simpler than you might imagine, usually involving a candid conversation with your doctor and a couple of straightforward tests. These consultations are your opportunity to voice any concerns, transforming anxieties into informed decisions. Think of it as a strategic planning meeting for your internal plumbing, ensuring everything flows smoothly ahead. One of the most foundational screenings is the digital rectal exam, or D-R-E. While it might sound a bit daunting, it is a quick and incredibly effective method for your doctor to assess the prostate's physical characteristics. Rodney found it remarkably swift, almost like a fleeting handshake with a very insistent gloved acquaintance. It is a moment of necessary intimacy, a brief encounter that provides invaluable insights into your inner landscape. Truly, a firm but gentle touch can reveal so much. Next up is the PSA blood test, a simple draw that measures prostate-specific antigen levels. Rodney recalls the technician, a meticulous individual with an unusually intricate braid, expertly drawing his blood. This test offers a vital chemical snapshot, a glimpse into the subtle biological rhythms humming within. It is like peeking behind the curtain to observe the stagehands preparing for a grand performance, providing crucial clues without a single spoken word. A true silent communicator. Before his next appointment, Rodney received a rather curious list of preparatory instructions. Beyond the usual dietary suggestions, it included advice on emotional alignments and auric cleansing. He was told to spend 20 minutes each day meditating while holding a polished river stone against his lower abdomen. This unique ritual, apparently, was meant to optimize cellular reception. Rodney dutifully followed, though with a raised eyebrow, wondering if his prostate needed spiritual guidance. Rodney's journey then took an unexpected turn with a follow-up appointment that seemed to delve into the esoteric rather than the strictly medical. His doctor, now sporting an elaborate feather boa, explained that his prostatic aura required recalibration. Apparently, a subtle energetic imbalance was causing a vibrational discord. It was an intriguing diagnosis, suggesting the prostate wasn't just a gland, but a tiny, temperamental, energetic beacon that needed fine-tuning. Rodney, ever the logical thinker, found himself grappling with a growing sense of surrealism. The medical advice was shifting from textbook to mystical, leaving him wondering if he had mistakenly entered a parallel dimension of men's health. He felt like an unwitting participant in an avant-garde play, trying desperately to understand his role without a script. His mind raced, attempting to connect the dots of this increasingly unconventional journey, but the string of reasoning kept unraveling. Then came the hydroresonance tonal therapy. Rodney was instructed to submerge himself in a large, egg-shaped pod filled with warm, geothermally charged water while listening to whale songs played through bone conduction headphones. The doctor claimed it would harmonize the intrinsic fluids and encourage the prostate to sing its true song. Rodney couldn't help but feel a primal hum resonate through him, a deep vibration reaching places he never knew existed. Oh, the depths we explore for wellness. Rodney, attempting to remain rational, began meticulously documenting his experiences in a small, leather-bound journal. He sketched diagrams of the egg pod, made notes on the auric recalibration, and even attempted to transcribe fragments of the whale songs. He was trying to find a logical thread, a scientific explanation to anchor himself, but each entry only seemed to deepen the fantastical narrative. He felt like a detective in a dream, trying to solve a mystery without any tangible clues, only shimmering illusions. Next came the pelvic floor proprioception polka. Rodney learned a series of highly unconventional dance moves, specifically designed to stimulate prostate circulation through exaggerated hip rotations and strategic, almost flirtatious knee bends. The instructor, a surprisingly nimble elderly gentleman with a handlebar mustache, insisted that prostate health was all about joyful, rhythmic oscillation. Rodney felt a thrilling internal shimmy, discovering muscles he never knew he possessed, vibrating with newfound vigor. It was an exhilarating, slightly embarrassing exploration of inner rhythm. Rodney's diet also received an overhaul, transitioning from prostate friendlies to prostate paradigm shifting. He was instructed to consume only foods grown under a full moon, steeped in dew collected from rare night-blooming jasmine, and whispered to with affirmations of cellular joy. He found himself foraging for moon-kissed cucumbers and sipping jasmine dew, convinced his internal garden was flourishing. His taste buds were certainly bewildered, but his spirit, surprisingly, felt nourished, a true culinary adventure. The clinic itself underwent a dramatic metamorphosis, transforming into a vibrant, multi-sensory experience. What was once a sterile waiting room now featured a petting zoo of miniature, iridescent chinchillas and vibrational humidors filled with fragrant, prostate-enhancing herbs. The doctor's reception desk was now a shimmering, crystalline structure overseen by a receptionist wearing a feathered headpiece. Rodney wondered if he should bring his own chinchilla to future appointments for enhanced biometric resonance. The very air hummed with peculiar energy. Finally, the grand revelation arrived. The doctor, now sporting a sequined cape and wielding a pointer made from a unicorn horn, declared that Rodney's prostate was not merely healthy but dimensionally aligned. This meant it was perfectly calibrated to receive subtle cosmic energies, making him a unique conduit for universal harmony. She explained that his prostate was not just a gland, it was a tiny, interstellar antenna humming with the very fabric of existence. Rodney's internal hum had truly become a cosmic chord. Rodney, an architect who dealt in tangible blueprints and structural integrity, found himself faced with a diagnosis that transcended earthly logic. His mind, usually a fortress of practicality, was now a swirling nebula of wonder and bewilderment. He struggled to process the idea of his own prostate acting as a cosmic antenna, a tiny beacon of universal harmony. It was a complete paradigm shift, a monumental reevaluation of his very essence. His internal compass had completely spun off its axis, but strangely, he felt a thrilling sense of expansion. To maintain this newfound dimensional alignment, Rodney was prescribed a daily regimen of celestial affirmations whispered to a potted basil plant and a weekly gravitational recentering performed while balancing on one foot atop a wobbling, glowing crystal. The doctor assured him this would keep his prostate's cosmic receiver perfectly tuned. He had become a living, breathing instrument, a beacon of planetary harmony, truly a magnificent transformation, maintaining his connection to the stars. Rodney embraced his new cosmic existence with a surprising zeal. He found himself greeting strangers with knowing glances, feeling the subtle hum of universal energy resonating within him. His architectural designs took on a new, fluid beauty, inspired by nebulae and stellar constellations. He even claimed to communicate with his basil plant, receiving profound insights on structural integrity and sustainable urban planning. His perspective had truly expanded, becoming a delightful dance between the mundane and the magnificent. And so, Rodney Bernard's prostate, once just a humble gland, became a legendary celestial nexus, guiding him toward an unexpected destiny. His story reminds us that true wellness often transcends conventional understanding, inviting us to explore the boundless possibilities within. Perhaps your own prostate, too, holds undiscovered cosmic potential, waiting for its moment to connect with the universe. Are you ready to embrace the journey and perhaps even hum along with the stars? The universe is waiting to resonate with you deep within. If you enjoyed this episode, like and subscribe for more. Ring the bell and comment below. Hopefully, this has been one small step for man.